here now for this last panel of this evening. I must say I'm very touched by the talk that we just witnessed, but we will go through this also in the best condition. I mean, also in my best condition. I'm a psychotherapist in training, and I'll do my best. Of course, we learn that, we try to be as good as we can, and that's maybe enough. So I'll go through this. Peter Gasser, Debora, Gonzalez, we already... Peter Gasser is a medical doctor specialized in psychiatry and working in psychedelic psychotherapy in Switzerland. Debora Gonzalez has a primary research interest in death in Western society and how to transform the conception of that idea, and she's currently conducting a clinical study to assess the potential of ayahuasca-assisted psychotherapy in preventing prolonged grief disorder. We heard her already today, but this will also be recorded, so I give some information for the context for people that one day maybe will listen to this. And Yasmin really was kind to join us since she's working basically in Switzerland, following the footsteps of the grandparents, right? Being now really involved in the multi-site clinical trial for psychedelic-assisted psychotherapy in palliative care in Switzerland. Yes, so thank you very much for being there. Thank you to be here. Can we have the clock starting so we will not get lost for that? Thank you. And just to give you a little overview of the structure of this panel discussion, I will just introduce the topic, and then we will have two pieces of text that I will read out loud, which will give us some hints on where to bring the discussion. Yes. So basically, the story of LSD in palliative care in particular comes out for the first time, as Zoe Dubu wrote in a recent published article, from the mind of an intellectual person, Aldous Huxley, which first wrote about this. And I don't know if you all know about this person. Aldous Huxley was an intellectual, meaning that he was a person playing with ideas and really trying to get some reasoning around many things, and among other things also altered state of consciousness and psychedelic substances. He was an intellectual. What does it mean? He's not a therapist, he's not a chemist, but he's playing with ideas, and sometimes he would then play with other professionals. So we see in this the development also of the history of science in the different domains. So he was the one that was having a correspondence with Humphrey Osmond, and of course these people sometimes they exchange poems just for the pleasure of intellectualizing thing and these feelings you can have about thinking and imagining things. So he wrote, right, to make this mundane world sublime, just take alpha gram of phenerothime. So that was a word for psychedelics, because at that point we didn't have a word to speak about this substance. And then you had another psychiatrist, Humphrey Osmond, answering to him, not by email but with a letter, right? To fathom hell or soar angelic, just take a pinch of psychedelic, which means mind manifesting. So he was involved in this domain, stimulating also doctors and to find ways to deal with all of this. I wanted to introduce you to his work because his work, like Island, which is a book that he wrote, like intellectual people, they write books to just share their ideas and their game of imaginations. And in this book you have an utopian society where basically they use psychedelic-assisted therapy in the case of palliative care. And they call this substance, this psychedelic substance in the book, moksha medicine. And then I will just go through the first part of this abstract from the book to just introduce some ideas that we can then contemplate all together. So there is this character of the book, which is William. He is a Westerner that just came to this utopian island where they really live differently and they have psychedelic psychotherapy. He is speaking with Susila, which is a therapist basically from this island. So it's also a clash of cultures, right? So William says, "What do you say to people who are dying?" he asked. "Do you tell them not to bother their heads about immortality and get on with the job? If you like it to put it that way, yes, that's precisely what we do. Going on being aware, it's the whole art of dying." "And you teach that art?" said William. "I would put it another way. We help them to go on practicing the art of living, even while they're dying, knowing who in fact one is, being conscious of the universal and impersonal life that lives itself through each of us. That's the art of living, and that's what one can help the dying to go practicing, to the very end, maybe beyond the end." So, of course, we had a meeting before, and we also brainstormed some ideas around this. The point here is that when we face such deep existential matter with a person who's dying, how can we really deal with that? Because the end is certain and it's not likable. But then, of course, there's a time in between the moment in which we are right now, if we are still there, and the moment where we will not be there anymore in this state. So, addressing you, if you've been in that kind of situation, or if you reasoned around all of this, how do you feel about this?
Please, Peter.
Okay, I start. I think the text talks to me in the sense of when I started the work with cancer patients, I thought that they come because they want to know what happens when they are dying, what happens after death. But I think none of them really had that intention finally until today. What they far more they wanted, and they learned also during the LSD sessions, what do I do with the time remaining? So it was more about living than about dying. What can I do until I die? What do I want to do until I die? And especially important, with whom do I want to share my time? And they became, I think many of them became more selective in what they did, and also in choosing social situations. And in that sense, I think that is correct. What here this is mentioned in the novel. And another aspect of it, together with Anke, we have in the group, Anke guided this person in the second LSD study. He has a metastatic colon carcinoma, so from the guts. And now he survived 5 years, which with that is a severe illness, is a prognosis beyond what you can expect to survive. And then in the last time when he came in August, he said a long time he was struggling against the illness. Am I healthy? Am I ill? Do I have a cancer? Am I healthy? Is my fight? Will my fight be successful? And now he said, I can accept that I'm healthy and ill at the same time. And I think this is very wise. It is very wise. I mean, he really cannot accept both, and he knows he is still here. And as long as he is here, he is alive. And he's 42 with 3 young children, so he's not an old man. And then but he knows that he has to die. On the other hand, yes, today and tomorrow he will be alive.
Thank you so much. Yes, for me, this resonates a lot also, and this is something that we usually see. No, I think that I saw it before. No, that we take for granted all the things that we have. No, and until we don't lose something, our time to continue living, we don't really appreciate what is important for us, and it's because we are like. It's not that death is a taboo, because death is almost pornographic in our society. It's everywhere, it's in the news, it's in the films, it's everywhere, but it's something that is not going to happen to us and to the ones that we love, no? And when this moment arrives, no, because we all fail in our willingness to live forever, it's like, oh no, all the things that I really want to do and it was important for me, and now I have just 1 year to do that, no? So I think that to learn to live with facing death, with death in our lives, facing our natural condition, no? That we are part of nature and we are going to die as this flower or as this tree, help us to appreciate more, no? The life that we are. That we have, and to live deeply, no, and instead of living, doing in the last moment. No?
Thank you. I don't know if you have a thought or something.
I also think there's a loss of meaning. I also agree with Peter that sometimes it's not just the being scared of death itself, but for the rest that is left for you. What are you going to do with your time? How are you going to spend it? With whom are you going to spend it? And just to find some meaning in what you have left. I think for this psychedelic assisted therapy is really helpful, and this is also what I agree on, is like help with the practice of living but being conscious of going to die.
Yeah, because this apparently would be one of the things that really help the people that get this treatment in that situation. They get more aware of their own finite life. This maybe sometimes we also listen to the experiences of people not having any illness, having like, we heard it today, like experiences of death and rebirth, and then they feel like they're transformed, and sometimes this really makes a change in the way they behave and they put priorities in life. So, is this happening also for this kind of patients in this particular situation?
That they make priorities in life?
Yeah, like if they also, like, how do they deal then? Why psychedelics, in fact, are really touching this point about the finite of human life, death.
Yes, I think really what I said. People become more aware how precious time is, and that you cannot wait forever for doing things that are important. Like I had a patient, after the first LSD experience, she said she wanted to see the pyramids of Gizeh again. 1 year later, she sent me a postcard from the Northern Cape in Norway. So, I mean, maybe it changed, the goal changed, but the wish for doing something that you like unfinished business. I mean, there is this film with Nicholson and about the bucket list, or this rich man with the other. What is the other? And they do a travel all around the world just to. I mean, it's Hollywood, of course, but I think there are some issues that maybe you want to do, and it depends on the time you have there. I mean, maybe in your study, Yasmin, what I did was not really palliative care. It was more psycho-oncology treatment. So I think some patients live for years after the treatment, like the man I just introduced before. I mean, he didn't know, but nobody knows the exact time of the death. So maybe even with a diagnosis of cancer, you can live a long time. But in palliative care, when you're in hospital and you know you will not go out of that hospital living, that is another situation. I think that the topics then change also, I can imagine.
But I still think it's the same on what are you doing in the amount of time that is left being here right now. But I also think that there are probably a lot of more personal issues arising during this more limited time that you still have in palliative care or end-of-life care than you have like the patients you treated with a longer life expectancy. So I think this is also a very important topic, the personal issues that need to be resolved, or also involvement of caregiver is also more prominent here.
I think that Aldous Huxley create the seed for all this research that has been done in psilocybin and palliative care and everything, no? Claro, he dropped the LSD in the moment that he was dying, no? Like for Claro, he dropped many times before also LSD, no, of course. but for me, it's like, okay, like to wait until the last minute is like, why, no?
Why?
So,
yes.
why don't we do it when they received a terminal diagnosis, or even before, no? When they are teenagers, no? Well, when the focus on prevention, because these plant medicines or psychedelics can help us to really question our ontological pillars, no? And to face our own death in these kind of experiences of birth and rebirth. So it's some kind of preparation for that, no? So as early as you can have it, as early as you are going to appreciate another level, no, of existence, or to take not for granted all the things that you have, because you are finite. No?
Yeah. In his book Sacred Knowledge, Bill Richards is writing about the situation with Huxley when he took LSD in the moment when he was dying. He does not see the sense of doing that. It is like taking a shower before you dive in the ocean. And he encourages to do the work with the psychedelics before, not in the last moment, just when you are about to die. I sit there, maybe you make the transition even without the drug. That's his message. It's a good idea.
Might be more comfortable, less painful though.
Yes.
Absolutely.
Yeah. But I have a slight contradiction to the text you were writing. When the therapist, she says about the art of dying, I feel not comfortable with the concept of the art of dying, because that implies that you can solve in some ways the process of dying in a non-painful way. And even my work, it was called the treatment of end-of-life anxiety with LSD. That implies in a way you can manage the end-of-life anxiety by taking LSD, and I think this is an error. I think the fear of dying is something inherent in us, and the goal of therapy cannot be to eradicate this final fear, and you don't know the process of dying. the woman I told before with the pyramids of Gizeh, she died 1.5 years after. And then a friend of hers gave me a phone call that she was dying, and she said she had a very hard death. So she was struggling until the end. And I think there is no guarantee by taking LSD that you will have a smooth end. And we have to accept that for our patients as well as for ourselves. I think it's the same.
Yeah, thank you. Was it, because you just mentioned the fact that also someone called you because of the situation, do you feel there's a particular process that must go on or that is involved within the caregivers and the family of the people being in this situation?
Sorry.
It's fine. I mean, I won't do any joke on this right now, right? So, I will not do that.
It's better.
I hope this is normal physiological process. Thank you. But I mean, if you need a piece of paper, maybe, or yeah, thank you. So the point would be to realize the configuration around the patient that is going through this. If there are some very particular things to consider when people get this kind of diagnosis, and to prepare them and the family and the caregivers around them around psychedelic therapy, which can also change a lot the worldview and the situation and the behavior of these people. Imagining maybe that they had some conflict with their families, and then this conflict reappears, or I don't know if you have some thoughts and feelings around that.
Well, I think that to involve in this process, I think that death is a relational process and a spiritual process, not only a psychological and physiological one. So as much as we can involve or embrace death as a family and as a community, it's going to be more meaningful for all of us, not only for the deceased person that, of course, to give a space to solve this unfinished business or to say goodbye to the people that we love is going to be meaningful, or to share stories. Someone was telling me a beautiful journey that some friends have with someone with cancer, that they go together to the sea and they are sharing beautiful memories together. No, this is something meaningful for the people who is going to die, but it's also really meaningful for the people that is going to bereave these people, because it's in this contest together where the seeds of resilience are planted and where we can grow together through the grief and the pain, no? And being together on that.
This is a very good point you mentioned, and I think I was a bit aware of that point, and Anke was more than me. But today somebody asked the question, should relatives attend the psychedelic session? In the morning, I think I was, and there it was more or less denied, and I agree with that. But I think in the end, coming relatives, especially when it's about cancer of one family member, and the relatives come in the end, or the partner comes in the end, in that peaceful atmosphere, normally that can be very touching and very also healing to be together. And as you say, having cancer is important for the whole family or the relationship. So I think we really should systematically include them at some point of the treatment. Maybe not for the whole day. I think this is not such a good idea, but at the very end.
Same.
I wouldn't include them during the psychedelic session itself as well, because they're are so many issues that are arising and so many conflicts. I think they need to first deal with them themselves. But I totally agree that you should always include relatives and caregivers at a certain point.
Because you say that maybe there are some kind of issues, not that they made to resolve, that is like related with that, because it's something that maybe the families is better not to be aware, or why do you say that?
No, I just think that first there are issues with themselves they are having, but then there are also these relational issues. For instance, I had like a patient. She was around 50 years old. She had a teenage daughter, and there was a huge conflict because she was going to die soon, the patient, and she was very ill. She had pain. But the daughter, she wanted to be a normal teenage girl. She didn't accept first the death, the imminent death of her mother. She didn't accept that she should take care of her mother right now because she's so ill and she's in pain and she cannot do a lot anymore. And she still had like the impression that she needs to be her mother also right now. It cannot be changed already, that she has to take care of her. It should be the other way round. And I think if someone is in such a vulnerable state at the moment and you already see all these conflicts before happening, you shouldn't deal with that, all that is coming up during the psychedelic session, but should address this at a later point.
Of course. No, in any case, of course, it could have some kind of preparation, no, with the family together, no. So everybody has to be aware what is psychedelic session, no, and what are the roles of each of the persons that are present, or even after if he's not present, no, because they are going to return with this family. So again, it's not going to have this role of a mother after the session, no. So in any case, it has to be prepared the proper context and family context to hold this together, no? Even if they are present or not, no. But also without psychedelics, no, because probably I didn't work with people dying. Just I saw my personal family dying, no. But I have listened many times to how it's very difficult for a kid to die when her mother is there, because the mother is like, or the parents are like trying to not that he doesn't die, you know. So many children die in the moment that the mother goes to the bathroom or goes to smoke a cigarette, and in this moment died. No, why is this? No, because there is not an education because nobody can teach you to embrace the death of a child, you know. So we are like trying that this doesn't happen, so people and kids couldn't go, no. So it's not only in the psychedelic sessions, no. It's in this moment of death. At the end is another kind of journey. So.
Of course, I think dealing with these things open up as well to always, facing death yourself as therapists. This work made a difference for you in your personal life and how you deal with death for yourself?
When I started with that work in 2007, Torsten Passi, a friend of mine, he said, pay attention with this work, that will affect your life. And I was so happy that I could do the trial. I didn't take it as a warning or as a kind of that I have to be concerned on that. But I think it is really, it's as a challenge to be confronted so often with people dying and people who do not want to die. I mean, normally those are coming who do not want to die, and I think I really have to pay attention on that, and I am in that sense also happy that Anke and me, we didn't do the first study together. So I think it is not that I can say, yes, that had become my friend and I'm looking forward and he is at my side all the time, and one day I will die like everyone will die. So I'm happy that I'm still alive, and I think now I'm here, and let me deal about dying in the far future. So I think this also, my nature is like that. I will not be against my nature.
Thank you. Thank you. I mean, you don't need to answer if you don't.
So you seduced me to give an answer.
I'll just go through then the reading of this next passage. We will have maybe a thought or a feeling around that, and then we will open up to the question from the public. Because this is also, I think, something important that we see just in the same paragraph just after, which is around the whole existential spirituality and the ontological reshaping of people's perspective when they go through psychedelics in general, and most importantly when they go through psychedelic assisted psychotherapy in that kind of settings, which happens sometimes. So Susila, so the therapist from the island, will say, yeah, and then they practice this art of dying, but in perspectives, different perspectives, to this very end, maybe beyond the end. And William, the Westerner, answer, beyond? He questioned. But you said that was something that the dying aren't supposed to think about. Susila answers, they are not being asked to think about it. They are being helped, if there is such a thing, to experience it. If there is such a thing, she repeated. If the universal life goes on, when the separate me, life, ego, individual is over. So William, right? Do you personally think it does go on? Susila smiled. What I personally think is beside the point. All that matters is what I may impersonally experience while I'm living, when I'm dying, and maybe when I'm dead. Impersonal experience. Since we also, we witness the testimony of scientists even using items called around the ego dissolution, for example, or this non-dual way in which consciousness can represent itself to people under psychedelics or in meditative states as well. So do you feel this is an aspect that is important for patient accessing this therapy?
To assess the ego dissolution state, you said?
Yeah.
In the psilocybin experience, no?
For example?
Sí. Well, maybe it's a how do you say, like some kind of mechanism of change to have this kind of experience that helps you to deal with anxiety, but maybe it's not the only one, no? There is this man, no, Becker, who writes the book of the denial of death, no, and he says, here is the terror. To came from the nothingness, to have a name, to be self-conscious, to have a willingness to live, and even that, like to know that you are going to go to the nothingness again, no? And this concept of the nothingness is something that is really print in our culture, and is very Western culture, no? It's because we are very materialistic, and we understand that consciousness is a subproduct of our brain, no? And so if there's no brain, there is no consciousness, and there's anything else. This is something that is really imprinted, and of course, to face this nothingness, not black, like blind, inimaginable, something that you cannot, that is some kind of terrorific, you know. And I think that maybe these psychedelics can help us at least to put to see this in different perspectives, no? That is really, really personal, no? To maybe to be more open as the mystery of death, no? That we don't know what is going to do, but to we don't know is the nothingness is very different, and the consequences for us is about how do we face that is very different also, no? So I think that maybe psychedelics can help us to question our fundamentals, beliefs, no, that we have, that we hold like our culture.
Thank you. Okay, thank you very much. And if you don't feel like adding anything, and it's not a inducing question, right? I will really leave, in any case, the public to ask questions, because I guess there will be some. So please, if you want to address the speakers, yes, thank you.
I have a question regarding relatives. You briefly talked about it, but sometimes there is some kind of interest of conflict. A patient who is terminally ill may accept that he or she is dying, but the relatives don't want to let them go, right? And my question is, how do you deal with this kind of conflict of interest between the relatives and the patient?
I mean, I don't think that conflict of interest is the right word in that situation, because there is no decision of letting him go or this person dying. There's an ongoing process that maybe will end with the death of that person. And so I think the first step will be to speak out what everyone feels and thinks. And then in the end, it will be about accepting what happens. I mean, it's not the dying person is, even this person is not the one who decides about the process. And then I think, not wanting, let go, you can not wanting, and it happens in any way. So I think the best would be to create an atmosphere where this can be openly discussed.
Thank you.
I think.
Yes.
Yeah.
Hi. Thank you for the discussion. Really interesting. The good thing with death, or the bad thing, is like we are all concerned with it. Even if you're healthy, you are sick, you're young, you're old. And your discussion remind me like what Montaigne, a French philosopher, Montaigne, said, like philosophy is a practice who teach you how to deal with your own death and the death of the people who you love. And so do you think we could understand psychedelics like a tool who could teach us to deal with death in general, And so if we understand psychedelic like that, we could imagine some social practices, institute to learn in a community to deal with that.
What an interesting proposal to do an institute about how to die with psychedelics, no? No, I think that is a very, very potent tool to also to question our fundamentals, no, and to even to die and rebirth, no. This is a typical experience also with psychedelics, and but is of course is not the only potential, no, that has psychedelics, no. But I really think that it will be something beautiful to do, you know, to do it in community, no, to face our own death before dying, you know, to live a more aware or conscious life, no. For me, I will tell that all that is done in community to growth as a community and that with psychedelics, I am in favor. So.
Thank you for this. I wanted to share the experience that I had with my mother and the palliative care that I helped give her in her last 2 weeks. I think that she had a good death despite having a difficult life. She suffered of cancer for around 9 years. She had breast cancer, and in the end it became metastatic. And what was important for her is to make the choice to die at home and to tell us that this is what was important for her, and to say goodbye to her friends. I was living in Switzerland, and I went back to Romania to say goodbye and take care of things. I was the one who put the fentanyl patches on her chest when the palliative care doctor gave this to us. We gave her the ice cream that she loved for the last time, and she had the priest that she needed to confess, and she told me some family secrets before dying. And in the last week, she was just in the coma, so she couldn't really say anything. But it was important that she had that agency and that choice, and that she could choose even the clothes that she would go to her grave in. And the peace that gave us, and what she revealed, that was very important. And I was very glad and thankful for her and appreciated that very much. So for anyone who is, you know, maybe has that type of situation, I'd encourage you to do that with your loved ones, because it meant a lot to us. And I'm very thankful for that. So just my take. Thank you.
Thank you for sharing.
Thank you. Thank you. I think we can be very grateful if something like that happens, but I would say you cannot plan for it. It's beautiful when it happens, and we are grateful for it, but it's not granted.
Fantastic discussion. I have a kind of follow-up question on this. Do you have in your practice case of patient that decided to do assisted suicide after a psychedelic experience in palliative care?
I didn't exactly get the question, so.
It's about assisted suicide and psychedelic experience in your practice in palliative care. Did you have people that decided to choose assisted suicide after a psychedelic experience, or you didn't observe that?
So maybe how people changed also their viewpoint on suicide and before and after this theme around psychedelic therapy. Yeah. Like. No.
Yes, I remember, at least I remember a patient. She was only 40 years old, and she suffered so terribly from cluster headache. And she came for treatment of cluster headache, and during an LSD session she had an attack of clusters, and then she said she will never take LSD again in her life. And then a few months later she decided to to do assisted suicide with exit, what she did finally, and they accepted, but it was not closely related. It was not the same week or so. It took maybe half a year in between. But for her, I think the LSD was really the treatment of the last hope, and she was so terribly suffering from that although she was only 40 years old, I in a way I can understand it, and then she died.
Also, these cases also happen in clinical trials when we are working with people with suicide ideation, and they try ketamine as the last opportunity, and it's not the first time that a patient goes to suicide after the treatment or the treatment. No, so.
So, hello. I wanted to ask, because I am working in gerontopsychiatry right now, so with older people, and in my experience, they are not that open to have a psychedelic experience or to drugs of any kind. And like, how would you go on with this? I assume the patients you see, they come to you because they know that you can provide this kind of treatment. But with people who don't know a lot about it, would you even recommend it in end-of-life care? Or, yeah, how would you go on with this?
I'd say you already need a certain kind of openness to the experience. So I wouldn't actually recommend it to everyone who wouldn't agree or wouldn't be willing or open to choose it by themselves. And yes, I suppose it's the case at your place as well, but usually these people come to us and they've heard about this. And as Peter mentioned, oftentimes it's also the last resort for any kind of disease or disorder they are suffering from, but still they decided to take it and they are aware of the risks and what they are going to do. So I wouldn't recommend it to just like anybody.
I think in addition to openness and willingness to do that, they should have the cognitive capacity to integrate an experience like that. And I mean, in gerontopsychiatry, many times people do not have the cognitive possibilities to really integrate.
Yeah, well, maybe my question is more about information, because I think that not everyone in the public is informed about the potential of these kinds of therapies and also about the risks. So how would you go on? Like, would you inform someone about the possibility when they don't know anything about it?
Does your clinic support it?
Well, where I work, we don't have any kind of psychedelic, and I'm just a resident, so it's not in my it's not in my level to decide something like that.
There, I think you would have to talk also to the relatives. I mean, they also have to agree. You cannot do it isolated with one person. And sometimes these people come to us and they ask, would that be an opportunity for my grandfather or whatever? And I mean, there you can start. But as Yasmin said, in general, I think I would not easily agree on doing it. But the oldest person I know taking LSD was a mother of a physician taking LSD at the age of 91. And she was about to die because she suffered from metastatic cancer. And she explicitly wanted to do it. And her son gave it to her. And she had a really good experience. And she said she was already far out. And 6 weeks later, she died.
Thank you. So that was about the time we had for this discussion. We will take the last question, nevertheless.
Yeah. Well, it's actually a follow-up on his question, so it's partially answered. But I wanted to be a bit more specific in case you have a bit more specific information. I work with Alzheimer's disease patients, not psychedelic at all, but I am curious. I mean, you partially answered. Your answer was like they have to have the capacity to integrate the experience. So I guess that means you would not really do it on people with neurodegenerative disorders.
It's time to answer.
Yourself.
You come down here. We do it in.
Okay.
Okay.
That was. Thank you very much for being here tonight and to having had this discussion with us. I hope we could, reflect on all of this stuff that are really, really important and in any case implied in all of our existences. Thank you.
Thank you.